time, 4 weeks out, I'm looking at scar work and she looks pretty good and flat. If we looked a little bit more keloid or almost looked like a caterpillar sitting on there where there's a girth to it, a lot of times there is a collagen matrix on the inside, and she really doesn't even have any of it, maybe a little bit here, where it will pop just like bubble wrap. It is literally hollow. You'll hear it. You can feel it collapse inside. It's really strange if you're doing it yourself. But all I would do is, as long as it's completely healed and sealed, which this is, straight in, smash it. Okay? If it's too early, she'll start, jumping around on me going, okay, this hurts too much. And over here, same thing, we'd come through it. Anything like this, we don't touch. Starting right there, smash. That's a stitch. Can you feel the line?
Mm-hmm.
Don't mess with those. And depending on how tender this is, maybe you don't do it too crazy. You can tell there's a stitch right there. You can see the discoloration. You see it right there?
Mm-hmm.
You doing okay?
Mm-hmm.
You're twitching on me. Okay, you can see swelling. Kind of shows up as a little bit different. Almost an orange peel effect. Looks like an orange.
Mm-hmm.
Week 1, 2, and 3, it was only going to be lymph work because it's too early to be aggressive. Like, there's no way I could have pushed on this at the beginning. When we hit 4, she's still a little jumpy, but way better. I can get more aggressive. At this point, I'm going, if we've got a lot of tissue that's really hung up, I can cup, and you can kind of see how this doesn't move. I think I'm going to cup you today, okay? How this moves? Yay. How this moves? No. It's right here. You can see how it doesn't move, as opposed to I can get a hold of it. She's pretty tight right here too. Everything else from the beginning, the rules stay the same for pretty much ever, amen? Watch that sodium. I want it kept low because we're truly killing ourselves with the amount of crap we're eating. Okay, so I'm gonna put it right where I want it here specifically today. We're gonna do it everywhere though. This is gonna give me better suction on the skin. And a glide. If everything is good, I'm gonna expect a glide through here, and then I'm gonna get hung up. So, we're just gonna test it. You okay with that?
Mm-hmm.
That's one pump. There's a pretty good glide. And if it's stuck, it's like hitting a brick wall. Okay, so you're feeling this.
Mm-hmm.
Slow down.
Mm-hmm.
Okay, and then we set. Now, if I sit here for, a minute, no big deal. If I sat here 20, she'd have a big hickey. And this is where you see when the Olympics were showing, they showed the hickeys on everybody.
Mm-hmm.
Not too bad. Better.
Mm-hmm.
Now I've got an internal stitches here where we put that abdominal wall back together. Sometimes it shows up pretty tender. Okay, hang on, right there. Okay, so in the beginning, you blow up like crazy as a survival mechanism, okay? It's drastic in the beginning. As you get further out, it's less and less and less. Everybody's different, so at that point, window-wise, I can't tell you how long you're gonna do it.
Sure.
She's fairly petite, so she's gonna probably go less time. Mm-hmm. Doesn't mean she doesn't yo-yo for 6 months easily. And again, once we educate you on how to get rid of it, you're gonna do it as needed for however long is needed. So she's still gonna get thinner through here, and she's holding water there, and we know she's holding water here because of how it is appearing, and it shows up. She'll continue to do the lymph work as needed, as long as she needs. And after, a recovery on surgery, I would tell you, use the lymph system for colds and flus, or I don't feel good. You start getting the signs and symptoms of not feeling right, jumpstart the system, slam the fluids, and you usually pee out a bug before it really ever sets itself. Just remember it's a garbage truck, so it's going to pick up the debris that we don't want inside of us, whatever it is, whether it's swelling, cold, flu, proteins, whatever. All right?